Valentine's Day. Hi. How are you all doing? Happy Valentine's Day. Wow. We made it. We made it, right? Through all that 2020 has brought our way, we finally made it to Valentine's Day. Kind of looked dubious for a second there, but aren't we so grateful? Well, here in Michigan, we're in the frozen tundra today. Woke up to negative feel like temperatures. It was like 1 degree, so 9. But it's getting better. It's getting better. It's currently about 6 degrees, but it still feels negative. Not a good day to be out and about. So if you're going out and about, know that you should take some caution because it is extremely cold. And the thing about it is when it's extremely cold like this, you really underestimate the extent to which you're covered, right? And what it does is it makes you feel as if you are not cold until you have a problem. So be very careful, right? It's Valentine's Day, and I guess most people would think we're talking about love. Well, I leave that for the love doctor. Dr. Rhonda Maddox is our love doctor, and she can talk to us more about love. I'm not an expert at love because I haven't won much at love. I guess I would call it if you want an expert, but I'm not. I have just had some experiences, so I thought I would reserve those. But I do encourage everyone to go out and have a happy Valentine's Day, whether you're going out to dinner or whatever. I myself am going to eat later. I eat every day, so right. Typically, I take myself shopping, right? I go buy something, but you look around and you're like, I kind of have everything I need. Is there something I want? And I really had to struggle with that, right? I need a new Range Rover, so that might be the next big thing. But I also need, before I get the new Range Rover, I need a whole lot of other stuff. There's some other stuff that I'm working on that I want to be able to realize first, like providing services to the people whom I want to help first. And it's a thing with me. I mean, I do this all the time. I place others' needs before my own. So yeah, I might want something, but then I tend to place it within the context of, well, what is the opportunity cost of that? And but there are, if you do this, you can help more people. If you do this, you can reach more people. So then what I need just tends to just, okay, I'll deal with me later. So it's getting to that stage where I'm actually asking myself, how much later are you going to delay your needs, right? Well, today is Valentine's Day, but I thought I'd bring some important information to you about why Native women are dying in childbirth. I guess by now most of us have seen the news story. Women in America are dying in childbirth at an alarming rate, something that we thought we had fixed and had rested since supposedly. And because our population is so large and as a developed country, most countries that are developed countries have much smaller populations than ours. This is why sometimes when they're coding statistics, it's important to put that into context. You have to contextualize it because our population is large for a developed country. The fact that we are able to take care of most of our citizens is remarkable because not only are we big geographically, but we're able to provide basically the same standard of living to most of our population across the board. The next country that is equally as large in terms of population and size is Russia. And we know outside of St. Petersburg, everybody else kind of just live in the areas. It's very heat in in extreme situations. That happens. So, but here in America, we're able to provide for our population resources. So we've become accustomed then to expecting, almost to the point where we're driven by our own expectations, that we expect at all times that we can provide all the services that our population need, right? It's an expectation that we have. And so when we come across things that don't add up, we kind of miss the boat because we have such high expectations of ourselves. When you look at us, we're a nation of over 363 million people right now, right? Spread out across this wide area. We have one state that is not joined to us, Hawaii, right? But so when we look at the composition of our population, we tend to look at it through the lens of most of us can afford to live, we can provide resources. So those who we checks and balance, right? We're a great group of people, right? We have issues, but we're trying to fix them. We're family, right? No matter what our color is, we're still family, right? We still look at ourselves. And you know how you know this is true? Check the country. You're in the minority. Everybody, because it's not an, and you start looking around and you start identifying those you think are Americans. And it doesn't matter what you look like, as long as you identify as Americans when you're overseas, suddenly you have an affinity because you recognize you have something in common. Well, we should take that and keep that at all times. We love our country and we love what it does and we want it to remain great. Okay? I myself, I can't begin to tell you. Don't. If you want to mess me up, start playing the Star Spangled. I kid you not. No idea what that means, right? So when we look at our population and we look at certain parts of our population that are more vulnerable, we have to ask ourselves: did we miss the boat here? Are we missing the boat? Hey, everybody! Thanks for joining me. It's Friday and it's Valentine's Day, and I know you're all like taking time out of spending time with your Valentine. Look at us, fluttering our eyelashes and everything. Yeah? Aren't you all happy? Right? And what are you going to do? By the way, let me just ask you this before I sink you into this. What are you all going to do later? Who is going out to dinner? Right? And who is going to do the do after dinner? Right? I saw somebody posted something on my Twitter feed, the things people post on social media, where their neighbor has been having sex all morning. And I said to myself, seriously, that's something you're going to post about them? And people were just like, hey, it's Valentine's Day. They're supposed to be doing that. And I was like, absolutely. And they kind of get a heads up on it. You know what I mean? They kind of get a heads up on this is what they're supposed to be doing. So take it easy, y'all. Take it easy. It's going to be okay. It's going to be okay. Right? So we're talking about Native women, Native and Indigenous women. Indigenous implies that these are people born to a specific area who are localized to that area, right? That's what it means. It means that they're native to this area. This is where they originate, right? Sometimes other groups of people like African Americans sometimes think that they're indigenous, but I want to make the clarification that African Americans are not indigenous to America. African Americans would be indigenous to parts of Africa. That's what indigenous means. You originate from that area, right? So Native and Indigenous women are dying in childbirth. I'm going to give you some background to this. About 5 years ago now, no, 6 years now, an OBGYN, an obstetrics and gynecologist here in the Metro Detroit area, brought to my attention that too many women were dying in childbirth. And I actually, he's a doctor and he's well respected, but I actually said to him, you're lying. I'm like, that's not true. I'm like, that doesn't happen. I said, even one person dying is something to talk about. But I'm like, are you serious? And he said, yes. He said, it's something you need to be aware of. And he said, they're primarily Black women and other women of color. And he said, and I said, why? I said, I thought that when everyone gets pregnant, you go to the clinic and they put you on Medicaid and so on. So are people not following up with their prenatal visits or what? Because I wanted to know why, right? And I was trying to identify the reasons why. And he said, no, it's not that. He said, I'm a white man and Black women are dying. And I said, oh, I get what you're saying. You're saying implicit bias has something to do with the delivery of care. So I said, but why is it happening now when it used to happen years ago, 40 years ago, 50 years ago, 60 years ago? I shouldn't say 40. I should say 50, 60, 70, 80 years ago. That was a thing. Why is it happening now? And he said, because it never stopped. And I was like, seriously? And he gave me the numbers at the time. The hospital he was affiliated with, he's retired. He has since retired. Because when he started talking about it, they thought he shouldn't talk about it. And so I listened to him and I said, is that something that is? And he said, yes, my colleagues and I are examining it, that it is specific amongst a certain population. And it is happening across the country. Because, doctors are busy people. They go to conferences, right? And they talk to everybody across the country, and then they develop affiliations with people in other areas. They collaborate and so on. So at the time, in order for him to, at the time I was on radio in Cincinnati and Covington, Kentucky, and Detroit. And so, in order for him to come on my radio, my syndicated radio show, to talk about it, uh, he had to obtain permission from his employers. Guess what? They did not give it to him. They did not want him to come and talk about the rate of women of color dying in their facility in childbirth. And one day he called me because he had just lost a patient and it was very painful. And he said it was preventable. Imagine that. You and I look at death as final, but he saw death as preventable. And he said it could have been prevented if the medical facility where the woman had gone to check in, he had left explicit instructions that when, if she were to call in, she was due for delivery, she had been coming to the clinic and he knew of her condition. He expected she would be delivered shortly, right? And he thought that he left instructions that if she shows up at the clinic, he's to be notified immediately. Well, she did show up at the clinic and they did not notify him. While she was writhing in agony in the emergency room, lying on a bed, waiting to deliver, they ignored her. They simply ignored that she wasn't feeling well. By the time they notified him, she was there for 2 to 3 hours, a time frame, a significant time frame. By the time he was notified, it was 2 o'clock in the morning. He had to leave home to go back to the hospital. By the time he got there and started attending to her, she was already in pulmonary, what do you call that? Pulmonary distress. She died. And because of lack of oxygen, the baby subsequently died. And he yelled at the attending doctor because he did leave instructions that he was supposed to be notified. When they decided to talk to him about it, he said that was it. It was enough. He left. He retired. He said, I don't need this anymore. I've been talking about this for years and I don't need this. He said this was preventable. So when he said it was implicit bias that was a contributing factor, I began to wonder, this is not unique. I had to examine myself. Have I been subjected to implicit bias in healthcare? And I had to start asking people around me. Well, I couldn't get a medical doctor to come and talk about it. I couldn't get anybody. And I started to research if anybody else was having the same issues. And I noticed that over time, a groundswell of it. So I had begun talking about it. I had written a blog about it. I began talking about it on social media. So people started to come forward and started giving their stories in different parts of the country because people's awareness topped up because it was happening to people whom you know. And when it started happening, it's a thing. So NBC News did this story recently. And it's interesting to note because this has been going on for some time. You've all heard of the tennis player Serena Williams, right? She had a similar thing. Serena Williams is wealthy. We can admit she's famous. She went into the hospital to have a baby, and she was meaning she had a pre-existing condition, a pulmonary disorder. So when she started complaining that she wasn't breathing right and she wasn't feeling well, the nurse ignored her. When the doctor came in, she pointed it out. They said, no, it was something to do with the circulation in your leg. When she when she did tell them that that was what caused it, she had to yell for them to get the doctor to attend to her. Then she's married to a white guy. Her husband, she called him and he showed up. And then they took a whole thing. If the doctor had not begun attending to her, she could have died in childbirth. So when that happened, she spoke out. And when she spoke out, then all of a sudden, everybody started to give their stories about all these young women, despite the fact that they have insurance, despite the fact that they can provide for their child, people are dying in childbirth for reasons that have nothing else to do, not because they are, far from a hospital or they died on. You remember back in the day, my grandmother had a stillbirth because they never had, babies were born at home. The midwives had to attend. So there was no proper prenatal care like we know it today, where you go in once a month, and then when you get to a certain stage, by the time you get to the third trimester, you're going in twice per month. They measure your belly, they listen to the sounds the baby's making to see if the baby's growing at the rate that it's supposed to go. What they're doing is making sure things are in order to have a live birth and to have a safe delivery. Do you see what I'm saying? A safe delivery for both mother and child. It's paramount, right? So why are indigenous women, native and indigenous women, well, there's a thing called implicit bias. So I want to be careful, and I want to make sure that we all understand what implicit bias is. So I wrote this definition down. Implicit bias is unconscious stereotypes that everyone has. So you can tell it's written by people who don't want to say, well, we all sort of are racist in a way, but implicit bias are unconscious stereotypes that we have. When used in healthcare, though, in healthcare settings, can lower the quality of care based on our perceptions of people, of their gender, of their race, their ethnicity, and socioeconomic statuses. That's what implicit bias is. It's unconscious stereotypes that we all have. So whether we know it or not, we've been socialized as people to look at others and to figure out, well, are they good or bad? Are they healthy or not? You know what I mean? And so based on those unconscious stereotypes, we have these predisposed, conceptions of people or perceptions of people that I hate, because we tend to put people in a box. And so when we see people, we attribute to them those preconceptions that usually invalidate the person and are incorrect. So we have these on, they're unconscious because we don't realize that when we are interacting with people, we're acting it out. Have you ever seen a group of people shake hands with another group of people and then they wipe their hands on their clothing? Well, they don't even realize that they just had an unconscious stereotype that the person, based on appearance, you have judged a person to be dirty or unclean, so you're wiping your hands off, right? You've all seen that. Well, that's an unconscious stereotype. That's implicit bias. So what we're finding is that even though Native and Indigenous women have access to care and have what is called proximity, because you're near a maternal center or you're near a center that provides medical care or health care, does not mean that you have access to good care. Access to care would be ridding and wiping away stereotypes, wouldn't it? Story, this woman is a real person. She signed to childbirth. Well, what she didn't know, and no one could have predicted, was that she would become the story. While NBC was interviewing her, waiting on her to give birth, guess what? She died in childbirth. Isn't that the most, I mean, that was just so earth shaking. I'm pretty sure the NBC writer who wrote the story had to seek therapy afterwards, even though you, as a journalist, you're not supposed to be in emotionally invested. Well, good luck. You're a human being, right? So can you imagine? She died in childbirth. She died in childbirth because when you look at it, implicit bias played a role. So the funding in Native situations, in Indigenous Native American women, the federal government, according to the agreement that they have on reservations throughout the country, are supposed to provide health care. What happens is over time, the funding for those are disappearing. Administration after administration reduces the funding, so there is not much to go around. So sometimes Native women have to go outside of their reservations. Well, what happens when they go outside of their reservations? They're subject to communal and community implicit bias, because then there are people there who are perhaps, for want of a better word, have no cultural sensitivity, right? In one situation, one Native woman who later became a healthcare advocate, she went to law school and became a healthcare advocate, said that when she was pregnant, when she showed up for care, they told her that, I know you people drink and smoke. That's a stereotype, because she says she didn't drink and smoke. That's a stereotype, right? So in this case, this woman, Stephanie Snook, agreed to be the guinea pig. She agreed to be interviewed based on the level of care that she had been provided by the healthcare facility during her pregnancy. Now, the woman had a pre existing condition. She had congenital heart disease and was told that getting pregnant again could impact her life, right? But she got pregnant anyway, right? So after getting pregnant, because there were limitations on the care based on budget cuts funding on the reservation, she went to a healthcare facility in the Seattle area, right? So she told the NBC reporter that she didn't think that she was being treated with any form of implicit bias. So she was due to be delivered 3 days before she was delivered. She had been complaining for 3 weeks that she was not feeling well, that she felt tired. Maybe they attributed it to the condition of pregnancy, which for most women who have been pregnant, we know that as the delivery date approaches, we do tend to feel tired. And these are the factors that doctors look out for, because you have to examine what is causing the fatigue. Is the fatigue being caused by just weariness of carrying a person, a whole human being? You're probably just emotionally belted out or whatever. In my case, I was emotionally belted out. You don't want to know. Right? Or was the fatigue based on the fact that she had a congenital heart disease? Well, 3 days before she died, actually, it was 2 days before she died, she went for a follow up check. The doctor didn't see anything wrong, despite the fact that she had been complaining that she wasn't feeling well. They did tell her that they wanted her to be in the hospital. So she went home and was children picked up, have her car parked, and then she went to respiratory distress, right? And they called the ambulance, and they spent 20 minutes trying to revive her. She didn't make it. She was pregnant with twins. So the doctors operated on the twins, trying to keep her alive so the twins could live. The twins lived for a week, and then they had to take them off life support. They both died. So she died, and the twins died. It was a problem in that community because people felt like her death was preventable. Because if she had congenital heart disease, why wasn't she being monitored more? If she went into the hospital 3 days prior to and said, I don't feel well, why did you send her home? Why did you tell her it was okay to go home? She's not here now, so she can't tell us what happened. Why didn't you admit her and say, well, your car is parked. Your car is parked. Call somebody and tell them come pick up the car from the hospital. But you need to be admitted now. This is the difference that they're talking about. This is what implicit bias does. It's all implicit bias dehumanizes people because it makes people, you don't apply empathy and compassion as you would someone who you are familiar with or someone who looks like you and sounds like you. So somebody who doesn't look like you or sound like you has a problem, you tend to look at them as if they're inhuman, that you find that you have nothing in you that resonates with their condition or feel any kind of empathy. I know that because when I lived in Central Florida, I lived in a predominantly white neighborhood. And one of the neighborhoods that we lived in when my ex-husband was at his most violent, I remember that I worked for a local supermarket. I was a cashier at a local supermarket. I kid you not. I have humble beginnings. We all start somewhere, right? And at the time, being a new immigrant, job opportunities are not open. People don't want to hear about your experience in another country. They want to hear about your experience here. I also didn't realize that I was also in the wrong place because of racism and so on. I should have thought about those things, but I wasn't aware of them. You see how implicit bias works? And I remember one day I went to work and it was my ex-husband had beaten me the night before. And I had used makeup to conceal the black and blue bruise around my face, around my eyes, and on my cheek. I think it might have been he was right-handed. When he hit me, he used this hand, so it would have landed on this side of my face. And he when I got to work, I was a cashier, and a woman walked up to me, a white woman walked up to me, and she said, "My God in heaven, why are you here? Why isn't he locked up? That brute who beat you up, why has?" And I was so terrified. And she went to the management and she said, "Why do you have this woman working out here knowing that she's being beaten up and you all are not doing anything about it?" And the manager called me and asked me. And I said, "Yeah, but I don't know what else to do. My family don't live in the area." They did nothing. They didn't call the police. They didn't do anything. Because I was perceived to be, I'm a person of a different ethnicity and race, they didn't see it as their problem. It wasn't the first time I had walked in with black and blue. That's why it didn't faze me. I walked in there with it all the time. They didn't see it as anything that warranted any kind of help. As a matter of fact, I had to leave that job because my ex-husband used to come there and park outside looking to see if I were leaving or something like that. And eventually the manager told me I couldn't work there anymore because he felt that I was, in a place where I could have caused a security problem. I kid you not, true story. I don't even know how I remember that because my therapist says that some of the memories I are suppressed to protect me so I don't remember, right? But that was a clear case of implicit bias. Now, if I were a white girl, I guarantee you they would have called the cops and had him hauled out of his house and locked up. But because there was no, I'm remembering the manager. I remember him standing there and I remember thinking, "Are you a man? How come you have no sympathy for a woman who looks like me?" And it's because of implicit bias. The unconscious stereotype that he has is she's not valuable. She's not someone whom I can relate to. So it affected the way that I was treated. And I remember telling myself, I don't want to lose this job because it gave me reprieve from the violence in my home. At least for a couple hours per day, I would be away from it. And that same woman who stood up for me, she empowered me in a way because I felt that I had to do something. So it spurred me into action. I called someone and said, "I can't deal with this anymore. I need some help." And I called a friend who was brave enough to come. Then my ex-husband went to her and threatened her that if she interfered in his life, he was going to call the police. And so her husband told her, "Don't talk to me anymore." So I was left alienated and alone. Uh, all poor women suffer. Now, at the time, all women, yes, all poor women suffer. Even women who are not poor, like I told you about in the case of Serena Williams. And even at that time, you wouldn't consider me poor because my net worth was such. You had property, you had money in the bank, you had income, so you weren't. We were above the federal poverty guidelines, way above. Believe me, the government didn't think I was poor at the time, right? But it goes to show how implicit bias works. You see what I'm saying? And I had that memory suppressed. I'm sorry to tell you about it. It might make you uncomfortable, but uh, it does happen. And when it happens, it does affect the delivery. I'm sorry, I'm moving, right? It affects the delivery of care that people are subjected to. And I'm talking about it because I feel some level of empathy and sympathy for this woman and for the family because she's gone. The babies are gone. This happened in 2019, in August 2019. So she's gone. The babies are gone, but the memory still lives. Now, has the family pursued a case against the healthcare provider? They're still dealing with the grief. I imagine within a year or so. What happened? Right? What happened? I mean, something must have happened. She went in to the healthcare provider. They examined her. Why didn't you admit her? And check this out. She didn't go into a clinic. She actually went into a hospital. So her doctor, the delivery of care was being provided in a hospital setting. Why didn't they just say, "You are admitted immediately"? You see where I'm coming from? That's how implicit bias works. That's what my friend who is a OBGYN was telling me all these years ago. That when women come in, they're treated and scorned. He said literally, he has had to talk to people about how they treat people. They scorn them. So he became known as a man who loved black women. And the guy was married to a to a woman from his, a German lady. He's white, she's white. You know what I mean? And he said he said he couldn't understand just because he was human. And he said it might have had something to do with the fact that he came from Europe, or he said it was just something that he said people are sick. He said that I went into medicine to help people who are sick. And I tell you, that man had to, he retired. He said, I can't deal with the bureaucracy anymore. I can't deal with the foolishness anymore. He said, I've spent my entire career doing this. He's like, I'm a doctor forever and a day. He went with Doctors Without Borders. And he's happier. If you were to see him, oh my God, he's slender, tall. He looks 20 years younger after all the bureaucratic stuff just dropped off. He said, enough is enough. Enough was enough, right? But it made me think about how this impacts the delivery of care. And I suspect that we're drawing attention to maternal mortality because maternal mortality shouldn't happen. Let me tell you why. Let me tell you why maternal mortality shouldn't happen. In the last year studied, 700 women in America died in pregnancy and childbirth. We shouldn't have that in a developed country, right? Black women are 3 to 4 times more likely to die than white women. Native American women are 2 to 3 times more likely to die than white women. And one of the things that we found in the study that I read in the study is that one Native woman who is Native American and white, she said that if she identified as white, it completely revolutionized the level of care that she's given. So if she goes to one healthcare provider and identifies as white, she gets a different kind of care. It didn't matter whether she's poor or not. This is what we're talking about. It has nothing to do with socioeconomics. It has nothing, because Serena Williams went into an expensive hospital and she was still treated like garbage, not because she doesn't have money, but because of the color of her skin. That's what we're talking about when we talk about these stereotypes. Implicit bias is simply based on unconscious stereotypes that have nothing to do with a person. It's how we've been socialized to believe about people. And this is impacting, when it starts impacting your health, it hurts your money. And we're all mad about it. Why? But when it starts impacting something like healthcare, where we go to the doctor and the hospital when we are most vulnerable. And this explains why a lot of people, even when they're sick, even when they know something is wrong, will not go into the hospital because they know they're going to be mistreated. You see where I'm coming from? People know that the likelihood of being left behind, the people who are about, as I feel so and so. I want you to know I'm human and I'm here. Make sure you deliver good care to me. That's my attitude. Otherwise, you're going to hear about it. So don't give me some sucky care because you have some unconscious stereotype that because we're not the same. Do you see what I'm saying? That's my attitude. We're not on the same level here. We don't have the same background. Right? Because if you don't, then they walk all over you. They treat you like garbage. And a test that could save your life, they could run a diagnostic test that could save your life, they might overlook because they assume, like the woman in the story, that because you are Native American, you are most likely to drink and smoke. Can I just be honest with you? White people use drugs at the same rate that black people do, if not more. There are more white people in the population. White people use drugs just the same. White people drink just the same. There is no such thing that black and brown people use drugs more than white people. That's a lie. Matter of fact, one study in New York City showed that white people use drugs at the same rate that black people do, 10%, same rate. But yet, black people are the ones who are typified as being proliferous drug users more than anybody else in the population. That's not true. White people drink just as much as black people do. We all have stuff. We all do stuff. You see what I'm saying? We all are equally game and are most likely to do these things. However, when you go into the healthcare facility, it doesn't matter if this is a poor white girl who is a single mother with 3 kids. As long as her skin is white, she's going to get better care than a black person who walks in. That's implicit bias. And it is contributing to deaths, to mortality rates, to maternal mortality rates. I do believe that it's also contributing to diagnoses and other situations in healthcare setting. They probably overlook you and not diagnose you from 5 years before because they don't care. I worry every time I go do a mammogram. I'm always asking questions. Do you see anything? Because I don't want to find out that you did see something, but you're not going to tell me, or you don't, because you don't care who sees. I don't care about her. So I'm very particular about that. You see where I'm coming from now that I know? I'm like, I ask questions. I said, do you see anything? I try to be nice to people, but I'm like, if you see something, tell me before you tell the doctor what. No, I'm like, you would tell me. If I were white, you would tell me. So tell me. I just ask questions straight up. I remember the last time I went to do a mammogram and I said that, and the technician was uncomfortable. I said, you're uncomfortable. I said, that's my life you're playing with. I said, I just want to know. If you see something, let me know. Don't wait for my doctor to tell me. I want this thing to be expedited so I can go make arrangements. I said, I have a family. I have children. I have people who are dependent on me. Do you see where I'm coming from? Speak up. And I'm saying this to all of us. We're a community and we're a family, right? You're my family. Because if you were to come on my Twitter feed and tell me whether I don't care what you look like. I don't care. You are part of my group, my community, right? You know I would stand up for you either way. You know that, right? So if you were to DM me or come on my Twitter feed and say, Harriet, I'm experiencing this issue in this area. What do you think? You know I would go to bat for you. You know I would address the situation, right? And I'm going to address it until you get redress on it, right? Well, I hope somebody would do that for me. People who don't have a voice, people who don't know how to speak up for themselves, or who have been so disenfranchised is a kind way to say that they don't feel that speaking up they're going to be heard. They don't feel that the society deems them, because they've been so demoralized, that they don't feel that a society is going to pay attention to what they say. This is why a lot of these things continue. When some of these women have died in childbirth, the family does not speak up because they feel demoralized. They absorb the attitudes from the society that say, well, she was nobody, she was this, she was not that, blah, blah, blah. Every human life is worth something, right? Do you know they'll pick up a homeless person off the street, fix them up, clean them up, put them together, because human life is valuable. I don't like to think that we don't value human beings, because I look at myself and I'm like, I wouldn't like to think that's how you think about me or my children, that we're not valuable. Just because I look different and I sound different from your common experiences and your commonalities doesn't mean that I don't hurt, and doesn't mean that I don't experience disappointment. You know what I'm remembering? To show this, I remember when I lived in Central Florida, when I was going for the divorce, my ex-husband, the judge was someone whom I told my ex-husband to vote for because I liked his platform. That happened to be the same judge I appeared before when my ex-husband was calling me names. And the judge took up for my ex-husband. He was a white man. He took up for my ex-husband. Yeah. And I had to defend myself because the city attorney, she didn't speak up. I don't know if she was intimidated by the judge or she was operating on what I now know as implicit bias, that I didn't have feelings, I was nobody. She didn't speak up for me. So in her absence of defending me, the aggrieved, I had to defend myself. And after a while, her supervisor had to say, the defendant is defending herself more than we are. She's capable of defending herself. I didn't think that was nice. I said, but that's what you're supposed to do. My tax dollars pay for you to do that, and you're not doing that. So now I have to question the judge, to the extent where the judge had to be recused, because I pointed it out, that you are defending the man who beat me up, and you are helping his attorney to advance against me. And the police report right here says that he beat me up. And I didn't respond to him. I didn't defend myself with him by slapping him back, or I was beaten. The judge had to recuse himself because the city attorney who was sitting there, who is white, did not defend me. That was a clear case of implicit bias. You see now why I say that my therapist is right. I suppress memories so that I can deal with it. Maybe I should go back and look up those cases and go deal with that. But it is true. That was a clear. If I were a white girl, my ex-husband would not have the time of day to stand in court. He would have been locked up with the key thrown away. But because of my color, I was nobody. Didn't matter that I lived in the same neighborhood as they lived in. Didn't matter that I had a mortgage just like they did. Didn't matter that I drove better cars than they did. Lived in the same neighborhood, had more net worth than they probably had. All their net worth was probably on a credit card. Mine was live and direct. Do you see what I'm saying? Implicit bias had nothing to do with my money, had everything to do with the color of my skin. And I didn't understand it or realize it until much later. See, by the time I figured it out, you know what happened. I complained to the Bar Association of Florida. And you know what happened after that? There were sanctions dropped. Be vigilant. And this vigilance, somebody said, this vigilance is tiring. Is the day when something terrible, and it doesn't matter who you are. I have friends across the spectrum, y'all. I have friends who work at higher levels of law enforcement and higher levels of government and high levels of corporations. Everybody is subjected to this. And it is not fair. Because just think about it. That city attorney, she was, to me, the difference between my ex-husband coming back home that night and further beating me up, perhaps even killing me. And she did not stand up to defend me. I had to defend myself in a courtroom in Seminole County, Florida, in Sanford, where Trayvon Martin was killed. Yeah, that place. And now you're all saying, well, Harriet, I didn't know. Trayvon wasn't a thing then. I didn't know, right? We relied on a realtor who sold us a house there. She could have told us. But my ex-husband was looking for somewhere remote where he felt he could manipulate me and alienate me, right? And so that city attorney contributed to, if had it not been for the intervention and the grace of God, I would not have emerged from that situation alive. That's what saved me, the grace of God. I kid you not. Suddenly, by the time I walked out of that courtroom that day, I had an advocate in my therapist who introduced me to a network of people. And by the time you know it, I got introduced to a lawyer who helped me to secure my freedom so that I wasn't beaten within an inch of my life. Right? This is why I'm talking about this, maybe because it's personal. If it had not happened to me. Before I go, let me tell you the story. I've never talked about this, and I hope my daughter doesn't hear it. She's now 17. I was pregnant, and my tummy was huge. And I was going to the doctor, and I remember some of the questions they asked about my socioeconomics and so on. I didn't realize it. I remember going back home and telling my ex, and he was very troubled by it. He was troubled by those questions. He's like, why do they want to know how much money we make? Why do they want to know? We lived in a middle class neighborhood that was a solid middle class neighborhood, right? And when I was huge, my tummy was big. I tend to have big babies. Well, they were more concerned about testing me for high blood pressure and diabetes based on my ethnicity than they were about anything else. And I remember when they asked for nutrition, like, what do you eat? I remember saying, why are you so curious about what I eat? And it says, and the doctor said, well, we just want a guide to know what your nutrition is. I said, do a blood test, and it will tell you if I've ever been anemic, because I've never been anemic or had any of those or had anything like that. I'll put, I'm a fairly healthy person. And I kid you not, I was hugely pregnant. Well, towards the end of the pregnancy, like about 3 weeks in, 3 weeks before the baby was due, my ex kept saying that belly is too big. Your belly is too big. But I kept gaining weight. I was hungry all the time because the baby was apparently always hungry. They kept measuring me and telling me that the baby was going to be, based on my previous daughter's birth weight, was 8 pounds. Well, by the time I was ready to give birth, she was big in childbirth. At the time when I was ready to give birth, they discovered that my birth canal was too narrow for the baby's head to come through. This is while I'm in the third birth. It's why I've never had children again. I was terrified. I was terrified, right? And that because the baby's head was bigger than my birth canal, they feared that I would have lost my life. Nothing they could, it was too late. The nurse who was in the delivery room, the labor nurse, was Black. She was terrified. She called all the leading doctors in the hospital. There ended up being a neurologist, a pediatric neurologist, a pediatric anesthesiologist. They thought by the time the baby came out, she would have been brain dead. They had their lawyers standing outside the delivery room expecting that there would have been a lawsuit that I would have filed. Because guess what? They did not take care of me based on my size and based on the size of my belly. They should have done more due diligence in examining me to see that the baby was bigger and do a C-section instead of having a live natural birth. But for the grace of God, I'm here today to live to tell the story. Can you believe it? I lived because of the grace of God. The baby was born. When she came out, she was blue, almost turquoise. Because she had had no oxygen for a prolonged period of time, she could have been impaired. I'm going to go hug her when I see her later, when I remember this. That was a clear case of implicit bias. Because of the color of my skin, it didn't have anything to do with my socioeconomics. I probably had more net worth at the time than the doctor or anybody else. But see, their implicit bias was suggesting that I could not be financially better off. So they judge me based on my color instead of who I am as a person. So even if they were to look at it socioeconomically, I lived in better neighborhoods than some of the people who work there. But they didn't look at that. That didn't matter. All that mattered was this. It was skin deep. Implicit bias could have killed me in childbirth. My ex was, you can well imagine, he was livid. When they told him the circumference of the baby's head and the circumference of my birth canal, I kid you not, for about 2 months, that man, he just kept looking at the baby. He would hold her and say, oh my God. But by the grace of God, I live. That's implicit bias. Now you know why the story is personal. Now you know why I had to tell the story and I had to talk about it. Luckily, by the grace of God, that's all I can say. She's now 17, almost 18. She has a big head. Yeah, we call her big-headed. She's bright. She has a bright future. She wants to study medicine. I guess when she heard me talk about these stories, she was like, oh my God. But as soon as I see her today, I'm going to go hug her because I remember what it felt like. Life is fragile. So today being Valentine's Day, and we're talking about this, if you're a guy, the woman who gave birth to your children, go hug her. Text her, tell her, I appreciate you. I love you for what you did. The woman who carried you, if she's still alive, the woman who gave birth to you, tell her it's Valentine's Day, but I love you more than you know. Tell her, I appreciate you. Your sister who has given birth to your nieces and nephews whom you adore, your sister-in-law, your cousins who have given birth, your friends at work, whom I'm grateful for your life and your contribution to my life. You brighten my day. Any woman today whom you encounter who is pregnant, tell her, can I just bless you? Can I just shake your hand? Can I just touch you and wish you well? Because it is so fragile. If by the grace of God, I could have died, I didn't have to be here. This is Harriet Kamek with Down to Earth. I just want to thank you so much for allowing me to tell my story to you. I love you. Thank you for your continued support. And today's Valentine's Day, from my heart to your heart, total love. Let's just shed love today. Just spread love. Love, love, love. Just spread love for Valentine's Day. I look forward to seeing you on Sunday. We're going to talk about love, right? And I look forward to seeing you next week. Continue to support my podcast by going to Anchor FM, as well as go to my website, harrietkamek.com, and tell everybody about this. Can you just share this for me? Can you share this with other women? And tell the women in your life how much you love them. The woman who gave birth to your children and the one who gave birth to you. Tell her you love her, right? I love you. See you later. Bye. Be blessed, everybody. Blessed.